a message right now that says that this session will be recorded, and because of that, the reason why we record them is because I use them for future training purposes. Your participation in this webinar indicates that you gave permission to use your, name, image, chat, all that kind of stuff. That's your consent to be recorded. Now, keep in mind that what I try to do is also take the recording and edit it later on so that we remove any identifying features. So this is mostly like your consent to be recorded, just in case I don't remove all of that identifying features, but we do use it for future training purposes. And the way that you can participate today, you can use the chat box. We would love for you to sign in. We had some folks from the Chickasaw Nation last week, and I didn't even realize it until I looked at that chat box. So if you could put in your name, your title, your organization, and email, that'd be great. To ask questions, you can use the raise hand icon to ask your questions, or you can use the chat box. Please go ahead and mute your phone when you're not speaking, but if it is an opportune time to answer or ask a question or make a comment about something, you're more than welcome to unmute and also directly ask the question. Use of cameras are definitely optional. We love to see your smiling faces, absolutely, but it is optional. And we'll be sharing additional resources, including like the slides for today through email. And then I haven't gotten to the evaluation yet. Still, I think I say that every week. But yes, we'll probably be sending out an evaluation for all the series that you participated in. So let us know your honest thoughts about how this is working for you. And especially if anybody is using any of the material, like if you're using the RShiny app, or if you have started to use Kobo Collect, or if you are using Tableau or ArcGIS or even Google Maps, or if you start using the Google Plus codes today, which I think is fascinating, hey, send us an email and tell us how you're using that, or how the information you've gleaned from this data management series is helping you conduct the mission of your organization. So yeah, we would love to hear about your success stories too. And I just want to say welcome again. It is so very nice to have you all here. We're going to start off with the smudging prayer. Creator, bless me this day to have good thoughts, to see good things in a person, to hear good things from a person, to talk good to a person so that I may walk with others in a good way. Thank you, Creator. Ha-ho. And we are going to start in a very awesome way today. We're going to start with Mr. Sunduk, and we are going to talk about digital addresses for the tribal community. Sunduk, are you ready?
Yes.
Excellent.
I'm just going to share my screen. Oh, can you all see my screen? Okay.
Yes.
Okay. So yeah, my name is Sundak Ganesan. I actually been working in CDC in Division of State and Local Readiness for the last 3 years or 4 years. I've been actually going to various jurisdictions locally and providing them training on how to use the maps for the emergency preparedness and response. And we do usually go training to a smaller cities as well as towns. Actually, we go and provide for the local public health department. It's usually a one-day training. Last year, we did more of a virtual training, and I'm sure we will have a little bit more training later this year, so we'll definitely keep you posted. So I'm just going to share some of the things that what we did during the tribal community, just related to the GIS specifically for the COVID response. So several deployers from CDC as well as other places, they have been going and supporting the tribal communities. So, and I'm just going to use one of the examples here is from Fort Belknap, and just to see what we have done. Again, there's a lot of different mapping things you can do, but we try to use it a simpler one that others can actually easily implement them. I'm sure you all have different stories too. Please feel free to stop and share your stories too. So these are the things at least we found. I'm sure you all have a lot of other bigger list of challenges with the addresses. So when we went for some of the projects, we went to the tribal communities, for example, household testing for the Binax Now or the rapid antigen testing. So the things that we found was when we went there, so many of the homes, they had a very vague address. I mean, you all can see that usually they tell them it's a blue house between mile marker. I didn't know actually what MM was initially. then they found, oh, it's a mile marker between 21 and 22. So that's sort of the vague addresses there. And a lot of them had multiple addresses. Some homes, they actually have a tribal council has given one, and then community may have one, and a county has one. So just some multiple things. And IHS records in the Indian Health Service record, they may have something different. So it was really a difficult way for us to find it. That was another challenge too. And then many of the IHS medical records, sometimes we find it as a PO box address. So I think that's many of them, they actually use it for picking up the deliveries and a lot of different things. But that's more problematic, especially for emergency responders, right? If they are trying to reach out to them to pick up the patient quickly when they get the 911 call, it's really hard. So I was talking with them and in a Fort Belknap and other places too. So it becomes really hard. Even the delivery drivers, like Amazon drivers and others, they also have trouble delivering the deliveries. And then some of them they know because they know their customers. These are the people who are ordering it. They just after a while they get used to it. And then also one thing we all know during the COVID situation, apart from doing the testing, we also have information where we need to provide wraparound services, meaning like for a person who is being isolated or quarantined, they may need to be given food or other essential service deliveries they need to be given. So in Fort Hall, actually, so in Idaho, I think I was working with one of the CDC Foundation staff there. So they gave them the Google code. This is the place where they are. And then it was very useful for them actually to deliver the things for them. So there's a lot of different challenges are there. So, and also the many healthcare providers, mostly at least I'm using an example from Indian Health Service, they may have routine patients. They actually go and pick up the patients for dialysis or other routine maintenance. So the van will go and pick them up and bring them to the hospital. And I mean, if it's the same driver, it's fine. But if it's a new driver, they probably would have a little bit time to figure out where their house is. So it's also an issue. The address is something very important that we need to have. So that's why I'm going to talk a little bit more about the digital address. In the other one is also most of the tribal communities, we all know that it spreads across multiple counties. And then in the county borderline is important actually also to kind of work with the multiple county health departments and try to work with them as needed. So these are the things at least I found challenges with the tribal address, and at least we started doing some of them. Maybe try to use a digital address as something it may be useful. And again, every tribal community have to explore with it and see. But I wanted to pause here to see if there are any other issues that you all wanted to bring up or anything else that I missed. So you wanted to add. So one of the initiative we try to use was when we went for this testing project actually. So you have a lot of different platforms are there for doing the digital address, like ArcGIS is there, so many QGIS and all of them are there. And then when we were doing this project, we had different volunteers, usually from a local tribal college or some other health staff. We call it as health tech. They would come every day. They'll show up just 5 minutes before we go to the household testing. So really don't have a lot of time to train them and do all of these things because you have a rapid turnover of local workforces were there. So, and we looked into various different things. We found out, okay, let's just use the Google, because Google, everybody already, they had it on their phone. Everybody had been using it. Let's just make it use of it as much as possible. Of course, we're not trying to use it for putting the PII and that sort of things, but at least we can use it in a way that we can still use it, plus also make it anonymous, so in that way you're not exposing anybody's details or which house has COVID or which house need to be tested and those sort of things. Only the people inside would know. And then you can see that basically Google Plus code is a way for assigning. I think it's the lowest unit, the smallest unit can be is like 20 meters by 20 meters. Every 20 meters by 20 meters, you can assign a unique code. That's how the Google Plus codes work. They, I think, released back maybe 6 or 7 years ago, silently released it. And then there's some places like in Africa, as well India, as well as even here, Utah, and as well as Arizona, they've been actually using it. So you can see that when in this person actually have just very alphabet codes, like just usually a 4-character code. That's what it is usually. It's sufficient enough. And if you want to be a little bit more specific, you can get additional things. For every house would have a unique character of 8 characters, just a simple alphabets. So most of the tribal homes, even here in Utah, they started putting these addresses on their mailbox or in the front of their house, so they knew exactly where they are. And then of course in India also they actually use it for for delivering some of these essential services too. Because even for opening a bank account, you really need an address. So that sort of situations, actually, these digital addresses have been very useful. So because the bank officer also knows, or everybody knows, this is the address I can exactly pinpoint. I know exactly where they are, and they can also verify if needed. So that's just an example. There's a small videos there in the links. I mean, I would encourage you to just look into it. And if you're planning to use these plus codes in some of the PDF documents that may help you to see. So bottom line is in this one, I know it's too busy here, but the entire world is actually divided into these sort of small blocks. And then it's not just for the house, but I also can say there would be a situation where you would need to do. So this is an example of one of the community in Fort Belknap is agency. So sometimes you really need a just a small of a code for a community or a neighborhood, right? So it's not just for the house, especially for public health surveillance. You just wanted to know just a unique digital address code to identify an area. It could be a small, it could be big. So that's what this is. So have anybody heard about Google Plus codes at all? I'll just pause here for a second.
Me, I have. I know that there is a service that uses it for EMS, and I know that Riverton, Wyoming, was looking into using the service so that they could better locate things. But I don't know if they actually went through with it or not.
Okay, that's nice. Thank you. Thanks for sharing, Jennifer. And then just these are some of the suggestions. What we had was, again, you all can implement differently in different ways. So you can actually, this is a sample, so it's not a real record, but in the IHS electronic medical record, you can see this, you can see the person's address is like PO Box 34. So we were actually trying to utilize them. Everybody anyway, just for picking up the patients or EMS or others, they usually look into the electronic medical record if they're going from IHS for picking up the patients. So we're trying to use one of the lines that already exists there, maybe line 3, we can actually use it for putting the Google Plus code. So the van driver knows, okay, these are the 10 patients you need to pick it up tomorrow for dialysis. Anyway, they'll be given the patients list on that day morning or previous day. So they will be able to, all they have to do is put those 8 character codes, and that makes it easier for them. So they put them on their Google map and they'll be able to pick up the patients. That's just a suggestion. And the other one is also you work the Google Plus codes for the community with the tribal council. So when we started, what we had was every tribal council usually would have some sort of the county area parcels and that sort of land details. They would have given it to the council. So usually most of the houses, they would actually have a latitude and longitude. So that's what, when I got it, when I started this, one of the tribal council members, they gave for each house the latitude and longitude that usually coming from county. So even if the tribal council doesn't have, they can always reach out to the county and get that information. Many counties, they also show this in an easier way outside too. But usually you can get it for your own council. You can get it from there. So once you get those latitude and longitude, and it's just in a Google, when you go there, I'm not sure if many of you have used Google Sheets. In the Google Sheets, there's an easy formula is there actually. So all you can do is drag, if you have a 1,200 homes are there, and then I just highlight all of them, and can you convert them into Google Plus codes? Within 5 minutes, I'm done. For every house in the address, I got all the Google Plus codes. So those are small things are there, and they will include those resources too. And then also what we also did was, when I was there, I shared that Excel spreadsheet. There were 1,300 homes here, and I gave those as a simple Excel spreadsheet to the EMS. So that way they can actually use it when they look up the address, or if they tell something else, if they can put their patient's name or house, they can do. And it doesn't need to be a personally identifiable, because you are identifying a house, not necessarily the person inside the house or how many people are there, right? So just leave it up to you, to the implementation of whether somebody wants to keep it public or somebody wants to keep it only within the tribal council. Either way, that they can determine how they need to share it. And then also, if you may not need to start doing for whole tribal council, whole tribal community. Say if you have a tribal community with 5,000 population, out of 5,000, you may just have to deal with maybe 200 patients who oftenly come for this chronic services, right? Dialysis or other illnesses. They come often, frequent visitors of the hospital. Maybe start with them. So at least you will gradually expand them in that way. So these are the kind of the things that we kind of thought of sharing, but you all may have something else, or if you have comments about these things, please do let us know. So this is just an example of a project. So one of the things when I started with them, we really didn't know exactly how the tribes and what the boundaries are. So the best way I would always start would be is in census as a good place, and included these links. It includes links for all the tribes. You can get an idea of the demographics from this link here, but I also have the census tribal tract. Like this is a Fort Belknap. I'll show you the real examples too. So you can use the census example to figure out the census tracts in the city. But you can see that we know that these are the 4 cities, 4 small communities we are dealing with it here. So you usually highlight them at the 10,000 feet level. Just want to know the bigger picture of it. And I'll show you the website too, and I'll provide the links so you can see the. So when you go to the census website, when you click on the tribal tract maps, and you'll be able to see all the tracts actually. So just every single, yeah, let me close this. Okay, every single reservation, you would be able to see your tribal lands that you can see and click on it, and we'll be able to see, for example, clicking on it, there'll be one PDF file. So the PDF file will look like this, and it's kind of maybe difficult to see when you're looking at it, but when you zoom in, actually you can get to see, for example, I'm trying to zoom in, there's a Fort Belknap agency, and you can zoom in, actually, it provides a lot more details, and then also you'll have a lot more other details on the right side too. So this will be a good place to start, especially for planners and others who don't want to get into the details of the maps and moving things aspect of it. So that's still always useful to print it out and have it handy. So it doesn't need to be always a digital ones. And then this again, also sometimes when we were working with the reservation, we also wanted to make sure, want to give some sort of a demographics aspect of it. I think Indian Health Service, they do have a good, nice summary, just a very short summary, just trying to give you an idea of it. It tells you about their community, and then what's the size of the population and that sort of things, right? Just it's always useful to have that information in addition to the map. And this just again, just to show you the county borders, just for Fort Belknap, you can see it's important actually to know this in 80% of the reservation is from Blaine County, and the 20% is Phillips County. So we're dealing with the basketball outbreak. It was really in Phillips County. So we have to work with the health department there. So whatever the things are there, and also even when you're testing too, IHS may be located here. So if you want to put the trailer, I think in this county it should be okay. If you need to put the trailer in a Phillips County, then it becomes the logistic issues are there. So and then what we just we have to work around those things too. But I think the county borders are quite important to know. And these are just the different maps are there. I'm not going to highlight some of these maps, but you also can see there's some of the websites are there that provides a list of all the tribal communities. So at least you know. And this one of them, I think they created in a tribal GIS website. So they have a nice app. So not only do you click on the map, but for every person, every tribal community, they have put in a point of contact who the email addresses, phone number, and websites are there. So it's really a good source. Actually, we'll include that link too. So I'm not sure if Audrey from Fort Belknap is here or not, but she was planning to join, but she was planning to cover some of these, but otherwise, if she's not there, I'll talk through this. So one thing we did was when we went to the Fort Belknap for the Binax Now testing project, so we need to know what the communities are. So different communities are there. So I didn't know exactly what it is. So I actually have to sit with one of the local person there. So with half an hour, they gave us an idea. Oh, this is the area actually is called Fort Belknap Agency. This is the area actually is different areas. So we basically made them, you can see these yellow boundaries on the Google map. We actually made these boundaries and labeled them as a community, not just the individual house. We wanted to address them as a community. Even in our forms, we actually have which community we're doing the testing. So we know exactly what testing we are doing in which community. So that's a very useful. It's in addition to the house having these boundaries. Also, when you're creating these boundaries, you also can put some notes about the communities too. So you can see here, this slide is just all about just the communities. I'm going to demonstrate them in the map too. So sometimes when they are when they are searching for it, we use the word labeling is also equally important. So when you want to search for a community, use the word community. So that way you can see all the communities in the search results, not searching for the results. Some ways to organize them. And these are the ones you can see. These individual dots are like all the houses, and then you can see all those addresses are here, and you can search by the street. You can search. You don't need to type in full name. You can just partial names are fine. And for example, if you're in a Newtown Drive, you just type in Newtown. It automatically brings all the houses in that street actually, so we can actually look into it. So we also try to provide them the tips how to use them, and so they don't need to type in full address. Sometimes when in the forms, some people type in Newtown as two different words, or sometimes they do. So that's why we try to tell them just enter a few characters so that you can pull them in. And then other tips also is just you can see these are the ones, right? When I typed in Hopi, I got all the houses in the Hopi, so it also shows all the results in a Hopi street. So that's just a easy way to look into it. Yeah, this is just an example just to show. Yeah. And then for every house, what we did also was we were able to map them, not only the plus codes. You can see the plus codes are the ones that you're seeing here. For every house, there is an address. Plus, in addition, we also provided a Google Map link. Google Map link, actually, once you click on the Google Map link, it also provides the whole lot of things, right? Like normally in the Google Map, it shows the closest gas stations and pharmacies, hospitals, all the commercial aspects of it there. So that's a nice thing with the Google. It automatically comes with all of those. You don't need to put any of those things. The same thing with the plus codes also for every house. When you click on it, it takes you to those plus codes, specifically showing those plus code address locations. And the other reason we went with the Google map was even with ArcGIS or any other maps, most of the tribal communities, when we go and try to see the house, it actually, that's what it shows in the 2D map. So you don't see the houses actually at all. You just see the sort of the streets are there. And we were doing the testing at the household testing. We need a way to identify the individual house. So it's really hard for us actually to look into it. So, and especially when you go into the real remote areas, you can't find the houses. So we always would suggest actually use the satellite view. So when you use the satellite view, actually you get to see the houses. And then I think most of I think the last time of tribal communities, they may have updated within the last 3 to 4 years. But even then you may see some houses maybe missing. So that's another thing that you may have to work with it, and you may or may not have the updated maps. But mostly, for most part, you would actually have those information. So yeah. Hello, anybody have any question? Okay. Okay, that's fine. So I think one other thing is, how do I find the Google Plus codes? Means normally when you're in a map, all of us are using a Google Maps, you hold on to any place you want, and it becomes a red color, and that means that, and it also shows up in this side. What's the Google Plus codes, and you can share it to somebody else. You can save it or do whatever things needed to be done. You can see that you don't need to have all of the specificity. Even this the first half is fine, 8 characters for a given community. Most of the time, the first 4 characters will be the same. For Fort Belknap, everything was 85WH, and all we have to deal with the next 4 characters. So really don't need to remember all of the 8 characters. It was very easier to remember to work with the smaller communities. It may not work for bigger communities, but at least you can still work with the 4 characters for the most part. And you can see that one, this is just an example of a Google Plus code. Like this is the code, right? So you can actually point to the specific locations, and then you can click on this and look into it too. The codes, and also it shows the satellite view. That's a big difference. The normal map doesn't actually show. So whenever using the plus codes for tribal communities, try to just to see the satellite view. So satellite view will show you the exact location, because some of the homes are like multi-unit homes right there. So we're dealing with it. So we really need to know the specific unit, not just the building. Really need to know as small as possible we can get. So we try to work with them. So that's what the Google Maps is. I'm going to demonstrate quickly a Google Earth. Google Earth is also useful and we are going to show a little bit about the Google Maps, actually how you can download the Google Maps offline. So that's the nice thing was when we were in the community, we don't get the cell phone signals. Some areas even getting the GIS signals between the mountains. We were tough time getting even the GIS satellite view. So those sort of issues are there. So you may want to consider downloading the Google Maps on your phone, and it works even if you don't have internet connection, it still works. So for most of the tribal communities, as long as you have 20 megabytes or less than that on your phone, you can download them. So that's something Melissa is going to show in a minute, but I'm going to show you just briefly a Google Earth and how you can actually use it. But of course, Google Earth, you would really need an internet connection. You may not use it in the field, but somebody in the tribal council or in the public health department, they can actually create them, use it for different purposes. I'll stop here before I go to Google Earth. If anybody has any questions or any tips or any other suggestions you may have used for the Google Maps in a different way in your communities, please do, just to maybe we can take a few minutes to discuss if you want to share anything else. Yeah, you're all quiet today, actually, so maybe we can move it to the end. We can have a little bit more discussions. So I'm just going to show the Google Earth. I mean, many of you have used Google Earth, and there's certain usage for it, when you would actually use it and when you would not use it. So the Google Earth actually provides the aerial view of the entire area, and you can literally fly through, like going through a drones actually, right? And then also it gives you, in a similar to a Google map, you have some things like, if you see on the right side, you have a street view is there, and you can do a 3-dimensional view, all sorts of things you can do. And then also you can set up different projects for your own community. This is just one I created for Port Belknap. And you can see I start with the Montana state, and then I know these are the 2 counties where they're associated with them. And then these are all the individual communities. So the advantage of using Google Project was this Earth was, if I click on Phillips County, when I search for Phillips County, it already gives me not only identifies the area in the Google Earth, but also provides me a link to the wiki or some other site that gives you the entire information about the county. Same thing applies for the state too. Those sort of things you can do. And I'm just going to go through the one county and maybe one community, just to show you how you can do. But you also can do it in a presenter's view, but I'm just to show you the Montana state. So when we were deployers were there, or also others, we were working on it. So everybody wanted to know where the public health department information was, and people are coming from different places, right? Or also you want to know every state's dashboard is located differently where they are. So for every state or whatever the locations you are designing, you can add these sort of notes actually. So I clicked on Montana, so you can see the dashboard links for the COVID and from the state public health department, USA Facts, and even Johns Hopkins University or CDC tracker, whatever you want to do, but they all takes it to the specific one. When I get to the specific county, say for example, when I go to the Blaine County, it actually zooms from Montana, it actually zooms into the Blaine County, and again, you can put the information at the county level. Wiki information is there. Google Earth also gives you a nice information just like this with the pictures, lots of pictures, and links to the videos too. So you can actually use those things too at the county level. And then after that, we also have to deal with some of the areas they are outside the reservations. So a lot of them, they didn't have the housing inside the reservation, so they actually put them, like Harlem is one of them, right? So they are not necessarily technically inside the reservation, but still a lot of the people from the reservation, they were living there. So you can see this actually. You can adjust the things using the maps, whatever you need to do. You can adjust and you can change different views. You can zoom in and everything else too. And then let me go into one of the areas, maybe Fort Belknap Agency. That's where the IHS hospital is there. So you can see that you can define the areas and work through it. And then once you get to a place, and you also can enable something called as a street view, right? So for example, I'm enabling street view. When I enable the street view, what it shows is the Google has actually gone through these blue areas, and you can still get an idea of the tribal community. So I'm going to click on it just to show you how it looks like. So it just takes me there. And actually, I can see this exactly where this is. This is the place actually we were doing a testing. So this is a casino was there. So we put the testing site there so that people can see there was a gas station there, a very commonly visible area. So we put the testing site there. So the trailer was there so that people are able to do it. So those sort of very useful things you can see, even for within your own community. If you wanted to share, these are the places we are looking into it, or setting up some locations for vaccinations or whatever things are there, you can still use these sort of things. And then of course you can go back to the 2D and or switch off this one, it goes back there. And also you can see the setup, the boundaries, right? You can click on this when you can edit these things, whatever the information you want to put them in. Like say you may want to put them your case information or whatever whatever the information you want to put them in, you can put them in a different context. You can just change the colors and do all sorts of things. It really doesn't require a lot of training. You'll be able to figure it out. And then also when you zoom out, you can see these communities, right? Then we'll plan them and you can just see, oh, this community, how many houses are there? You get an idea of it. So it's a good way of navigating and working through it. And also you can take the pictures and then as needed. So that, and also you can present them too. You can use it like a PowerPoint, right? So you can just do like a PowerPoint and then navigate like a slides. So it's more of a presenting your surveillance data. You could even present them for leadership or tribal council. Oh, this is what's happening in this community. This is the number of cases in this community. Just it's all you have to do is just move through the slides. It's a visual way of navigating it. So, and also people know what they're talking about, not just looking at the numbers alone. And especially if you have people from who are not from this reservation, they may have somebody else from the state or somebody else from the county. They just different people are there, so it kind of helps. So I'll stop here and see if you have any questions about Google Earth. And the last thing I want to mention about Google Earth was you don't need to put everything on the internet. So tribal councils, if they want to put some sensitive data, there's a Google Earth, the desktop version is there. It's very powerful. You can add anything you wanted, actually, and even the surveillance data and other stuff. You can keep it within your own desktop. You don't need to publish them outside. So you can actually print a particular area, take a picture of it, and save them as a PDF. Whatever things you need to do, you can look into it. And also you can draw a lot of these shapes are there here. You can see these different shapes you can do, and you can make any colors you want, and you can put locations, those sort of things. I'll stop here to see if the pause here for a second, just to see if you all have any questions before I go into some of the surveillance data, how we put them on the map, a little bit more in the detail. And then there's tons of YouTube videos there for these. So you within 2-3 minutes, within 5 minutes, 10 minutes, you'll be ready to go. So now I'm going to shift, maybe just we can talk a little bit more in detail at the end. So this project, I'm going to talk a little bit more in detail what we did for the testing, and just more of a data, what we put them on the map and how we actually used it, a little bit more specifics. You can see actual maps. So this was a trailer, we actually used it for testing. And we took it in different locations in different days, and then we kind of look at the houses, and then this is a test. By next now testing was done 15 minutes, we will get the results. And this just, I think last time I shared, we actually provided the locations where we would be, and we also had a schedule, and we published the schedule on the small Google site we created. So the councils and the radio stations and others, they linked it to this one, so they know exactly where we are going to be. Of course, we also set up a number so people can call us and find out where the testing is happening. So when we started with them, we didn't know where we are going to set up these things. So definitely we made, again, for brainstorming purposes, we said put one trailer here, put another trailer here. And for all the smaller communities, all of them going to be covered by one trailer. This also helps us actually, right? So visually for planning, whatever things you're doing, just put the maps and try to organize them, whatever the way we need to do. And then this just, I think I kind of already showed these ones. You can download it on your cell phone or a tablets. We actually use the Samsung tablets. So because we were also collecting the data using the Kobo toolbox, that was also on the same thing. So when we were actually using it, we were able to collect the data. It uses the location. If they are in the house, it'll capture their house and try to put them in the details. And I think I'm going to skip this one. This is the one we started with. We wanted to get the buy-in from the tribal council. So we said we're going to do the testing for 8 weeks. Every 8 to 10 weeks, we're going to do the testing. Every week, we're going to do the testing. So we have to do some sort of a mock-up brainstorming. So for example, we wanted to know who's agreed to test and who's refused to test. So for example, things like these red triangles, we definitely don't want to go to those houses because they refuse to do the testing. They don't want to participate in the testing. It could be multiple reasons. They may have recovered or whatever the reasons are. So in those situations, we don't want our testing community to go and bug them. So we really need to capture them for each community. Please don't go and bother them, those folks. And the other one is also just, again, this is just all mock-up data. You also can try to, every week you wanted to know who was tested positive, like you can see with the red ones, and then who are tested negative. And then sometimes when we go to their house, they may not be there. They may have gone to work or they may have stepped out, so we may not be there. So we kind of mark some of the homes that to say, oh, these are the homes you really need to go back and remind them to do the testing. So we try to wait them until Thursday. And then most of the times, even for the household testing, since we also set up the trailers in multiple locations, they would they don't need to be tested at home. They'll themselves stop at one of these trailers near the casino or other places. They'll do the testing too. But this gives us a reminder for us to plan. Again, the maps is quite important. You can't just use the address. You need some sort of a visual things, because I usually print them for the field staff to say to just print this one. You're going to this community today. Oh, this is the map. This is the situation, so they kind of know and work with them. We also share this with the public health staff too, public health nurse. They actually need also for contact tracing purposes. They know that these 3 houses are dealing with the COVID situations. They may need to also kind of start looking at the contact tracing perspective to the surrounding areas. And most of the time, they already know exactly where the houses, the local public health staff, but sometimes we do contact tracers from a county and others, they may or may not be there. So I think these sort of visualizations help them. And then also the other one is you can still publish the data in a way for your team, still make it anonymized. Like for example, we came up with the idea of just using the sporting team. Let's not identify, let's not put the red color and all these kind of things. So nobody knows what these means. There's a housing, the horse riding is there, bicycling is there, and fish is there, and all sorts of things so that we know, decode them and say, oh, this sign means refused. They don't want to be tested. This one is no one at home. You need to go back. Or this one means somebody may have been recovered. So they don't need testing. Once they got COVID, and then they don't need to be part of the COVID testing anymore. So I exclude from the testing program. So those sort of things, you can use this one. Still, only the people from the testing program, they know what it is. Again, all of these done in a Google Maps. We share them only with the people whom we need to work with. And then at the same time, we also had one of the basketball outbreak situations, so where a lot of people got exposed. So the previous week, they had some sort of a symptoms, some sort of what do you call the exposure they had. So they were negative at that time. So for the next week, when we were preparing for the testing, so I wanted to give them the field staff to say that make sure you go to these homes for testing. They may be negative still, but still wanted to follow through and make sure that you go to these houses and test them. And also we give the same maps to the public health staff, so they can actually, BinaxTest may not pick it up, so they may actually can follow through these maps in detail and then do the PCRs. Again, these are all done using simple Google Maps and Google Earth, nothing complicated at all. But you also can see that one, we made it specifically for each locations, whatever way you can do. And it also helps for the tribal council or the leaders. You wanted to sometimes always create some PowerPoints to talk through it. You can't do the real-time navigation of the maps. You get lost. This is also another one, the Kobo toolbox. This is really taken from a Kobo toolbox. When we capture the location for each one of the places, it captures the location of the house, and you can see the heat map. This kind of tells, oh, really, we have tested every single house in this community. This gives you the density of the testing, like over the 8 periods of weeks, how often we have gone, whether we have covered everything else. I mean, of course, these things you can create it for every week or cumulative, whatever the things are. Sometimes you may see some of them blank because they are a commercial locations, not necessarily the home. So this kind of gives you an idea of things like that. And I also print the map for the staff to say, in addition to the maps, sometimes they also want to see the numbers specifically. Tell me the numbers. Sometimes I don't know exactly which house it is. So they may be walking here, and usually in their maps, if they are using the phone, their location will be shown as blue. So the blue location will come in here, and as they get closer, they know they're closer to the house. So they already know that, because GIS still works even if you don't have the internet connection. So those sort of things that you can actually use it. So in those cases, I didn't put the address here. I say, make sure you go to these 8 houses. They had exposure last week. Make sure you get to them. Or these are the 8 houses they are interested in the household testing. So make sure you go and cover them. So that sort of things. Sometimes map, in addition to the map, a simple list also would help. But combine them in a PowerPoint and print them in just a sheet, so they can take it over. Not necessarily everything has to be digital. So just we had a big legal sheet paper, or even the regular sheet paper is fine. That would work too. And also this also would help. So at the end of it, we can say at a bigger level, this is entire Fort Belknap. We can see all the testings we have done. These are not individual houses. This is the testing, the number of the tests we have done. So that's the end of my part. I'm going to transition over to Melissa so that she can demonstrate some of the things related to how we can actually use the download the Google map and then use it. And then of course, we also have another presentation, so we can take the questions at the end. So it's just we'll have enough time for discussions. I'll stop here sharing. And if you want to take a break while Melissa is preparing, we can take some questions too.
I don't have a question, but I thought it would be a good comment maybe. I know that often we don't know what tribal communities look like, but we're working with tribes. So getting a perspective on how large the tribe is and how their tribe looks would be a really good tool just to get a glance at what we're working with from the distance that we're working. So just wanted to comment like that. But I'm looking forward to learn how to use the satellite and the Google materials.
Yeah.
Thank you.
So one thing I forgot to mention was we didn't show the real map of it. So for folks like somebody at the federal level or state level, we have created the maps, actually simple Google Maps. It has different layers to it because you can add layers to it, right? If I wanted to highlight the health facilities of the IHS, I can highlight them. All the tribal lands are here. So all the land reservations are there. So whatever the areas you want, you can see for the entire country, you have all the reservations, all the boundaries are already there. So you can make a copy of this one. All you have to do is log into your Google Map and you can make a copy of this map. So we can share this resource. So you can take this as a template and you can focus on your area and highlight them, whatever things you need to do. So when you zoom in, it actually shows you whatever the locations are, the hospitals and different things. Whatever you want to do, you can select the ones that you wanted to show them. And this is the Fort Belknap community I was talking about. This map link is also there, so you can look into it. So one thing with we tried the same thing in Fort Hall. So here it was a smaller size. One limitations with the Google map is it allows you, I think maybe about 12, maybe 1500, I think is the maximum you can have in one layer. So what we ended up for Fort Hall was we have to create a northern portion of the homes as one layer and the southern portion of the layer as another layer. So we made it as a two parts. So in any one given place, one layer, what I was called one collection, is you can just have only 1500 of them. I think most of the tribal lands, you would not have any issues. And you also can put them in other things like we put them in the county subdivisions and also the schools too. You can add the schools, healthcare facilities, like I can highlight them, the elementary school district or high school district, whatever things you need to do, you can highlight them as needed. So it allows you to do all of these things. I think for tribal community, Google Maps is way more than enough for just to work with for most of the use cases. Okay, Melissa, I'm ready to stop sharing and you can take it from here.
Great, thank you, Sundak. I'm going to start sharing my screen in just 1 minute. Just wanted to introduce myself. Good morning, everyone. My name is Melissa Victor. I'm also a member of the Tribal Support Section within CDC, and I've been serving on that team since about October of 2020. So happy to be with you all today, and please let me know if for some reason you all can't see my phone screen. All right. Okay, great. Hopefully everyone can see my screen. I just wanted to do 2 quick demonstrations, and like I mentioned, we have PowerPoint, so feel free to return to that at any time to revisit this. First, we thought it just might be of interest to you. You might have already seen this, but Google has added a COVID-19 layer so within the app, and this offers some critical information. It's designed to really help you decide where to go and what to do while still staying safe. And they use a color-coded system to show you the density of new COVID cases in any given area and a label to tell you whether cases are trending up or down. And this information is visible for all 220 countries and territories within Google Maps. I'm going to pull up a high density area for you all just to show you in some more detail. And if you see on the right hand side, there's a layers button. So I'm just going to click that. And then right here at the bottom, it says COVID-19 info. And basically, as I mentioned, this does let you know of any new COVID cases in any given area, and it displays the 7-day average for the number of new cases per 100,000 people, and it's color-coded system, so gray is less than 1 case, yellow is between 1 and 10 cases, orange between 10 and 20 cases, dark orange between 20 and 30, red between 30 and 40, and dark red is 40 plus cases. So this is just kind of a nice little visual, and you can sort of see in depth here the difference between some of the different counties in Los Angeles, but as I mentioned, this can really work anywhere. I just wanted to give you guys a nice visual. And then for our second demonstration, I just wanted to demonstrate, as Sundev mentioned, how to actually download a Google map. And this feature allows you to download a map so that you can view it without a Wi-Fi or data connection. But just a reminder that offline maps are only able to provide driving directions, and that traffic information at the time would not be available because you won't be connected to Wi-Fi or have service. But I'm going to pull up Fort Alamo Reservation. And please let me know if for some reason you can't see my screen. But on my tablet, basically, it gives a nice map overview of the reservation, just sort of a small section that you can download offline. And if you scroll to the right, you see this download button. If you click that, it will ask you if you'd like to download. And remember that it will take up, for this map, it'll take up 20 megabytes of free space. So you're always free, of course, to delete these maps when you no longer need them, but can be really useful if you know that you will not have cell phone service or coverage. It might take a second to download. Perfect. So, so this map will now be in your saved offline Google Maps. I'm not going to go offline because it might take me, it might disconnect me from here, but you will have these maps saved. You can have several at one time. You can, as I mentioned, delete them. And these instructions are within our PowerPoint, but just wanted to briefly demonstrate those for you. And just let me know if you guys have any questions.
Thank you, Melissa. I think I want to make one comment because I went to one of the responses in tornado response in Alabama. So there, the whole cell phone tower fell down. So there was an issue. People couldn't get the cell phone signals. They couldn't actually see the maps either, actually. So it was really difficult in those situations, especially people who are working in public health, or even for other people too. It's always good to actually download your maps. So in that way, you kind of know if you're trying to navigate or some things like that. It would be useful to have. It still shows your directions. It still shows everything else, whatever you need to do. Even without the cell phone signals, it will work. It could be really one of the important preparedness activities in not just for COVID, anything else. Say if you have a radiation exposure, if you need to go to a close by county or close by areas, so at least it allows you to zoom in and zoom out. So you just have at least everything in hand in case if there was any of the issues with internet connections or cell phone signals and other sort of things.
Yeah, great points. Thank you for pointing that out, Sundak. Really appreciate it. Yeah, extremely important and extremely useful in everyday life as well. So thanks, everyone.
So Jennifer, we can take questions at the end. I know we have the Tableau presentation, so we just want to make sure we cover the presentations and discussions can be held in the last few minutes. So Mr. Sam, I think if you want to share your screen, I'm not sure Jennifer is in mute or she's still there, I think. If you want to share your screen, if you're in Teams, you could share your screen if you want to demonstrate the, yeah, thanks.
Okay, yes, sure. Okay. Thank you, Sandak. Thank you, Melissa, for this great presentation. And I'm glad today to be part of this and talk about Tableau or maps in Tableau. First, my name is Sam, and I'm an epidemiologist at RimTech. And I would like today to talk about maps in Tableau. Tableau is one of the easiest software to create maps. It doesn't require programming or coding. If you have some experience with data analysis, you will create more advanced maps. But if you don't, that's totally fine. You will still make some gorgeous maps. And I will demonstrate that in a second. But before I open Tableau and show you how to create maps and how easy it is, and you will be the judge of that, I would like to show you a dashboard that we have created not a while ago. So we created a dashboard for COVID-19 cases, and this dashboard shows the cases in Montana and Wyoming. You can switch between them. It shows the number of cases and deaths, also case fatality rate, tests, and new cases as well. And here we have two maps. I will skip them for now because they're going to be the main topic. And here we have the trend at late of November and beginning of December, the number of cases peaked, and they were averaging at about over 1,200 a case per day, which was a lot. But now we are averaging at about 99 cases per day, which is something we should be grateful for. And we see this drop because many things, because one of them is the vaccine. So if you haven't been vaccinated yet, so maybe, I don't know, maybe you should consider it. And some other information. So if you live in Montana and Wyoming, you can bookmark this dashboard and look at it when you want to know what's happening in your area. Okay, back to the maps. So here we have two maps that shows the number of cases and deaths in Montana and Wyoming. It might look a little simple. Tableau can do more than that. But what we wanted in this dashboard is to have a map of counties that shows cases. We wanted it to be simple. That's why it's simple. And here we have a parameter. If we want to see the cumulative number of cases, we click here. If we want to see the new cases, we click here. And it takes three or 4 seconds to load the data. Okay, it's taking more than what expected. Let me refresh the page. So here we have the color legend. The county with the lowest number of cases has 12 cases of COVID, and the county with the highest number of cases has over 17,000 cases. And that's Yellowstone. Raise your hand if you are from Yellowstone. Also, let me check this again and switch it to no. Okay, now we see the new cases. The highest, the count with the lowest number of cases has no cases, which is great, and we can see a lot of counties that has no cases. Anyways, let me now open Tableau and demonstrate how we can make maps like this. So here we have the data set that we're gonna connect Tableau to. First, we open Tableau. The first thing we want to do is to connect our data. So now that we connected our data, here we have the variables that are in our data set. We have the date, county, state. Okay, don't worry about that for now. We're gonna need it. And we have cases and deaths. So let's go ahead and create our first map. So we go to Sheet, and here where you make all your visualizations. And by the way, Tableau was not designed specifically for maps, but it does good job creating maps. I just wanted to point that out. So so here where you make all your visualizations, let's we need to change if we want to make it. And on the left side, we have all your variables that we just saw, the date, state, county, cases, deaths. So we change that to maps and double click on state. And here we go, we have a map. So we want to zoom in the United States. Look in. Of course, you can see more details if you want to see the streets, the geographic features like mountain and all of this stuff. We can see that. Let me show you how. Let me exclude Montana first. You can do that through going to map layers and you choose the style you want. Let's say we want streets, and let's zoom in to Montana. Okay, Montana. Here we go. Let's zoom in Billings. So here you can see all the streets, and you can change the style to be outdoors as well, to see more geographic features. And if we want to see a satellite picture, you can do that as well by clicking on satellite. But for this demonstration, I'm gonna use normal. And let me zoom out a little bit. Let me zoom in again to the United States. So let's say let me go back so I include Montana.
And Sam, while you're zooming, we have a
Yeah.
question in the chat that says the slides. If will there be notes on the slides that you share?
No, I have no notes. I have only one slide, so.
Oh, okay.
Yeah, I just wanted to do a demonstration.
We'll make sure that we get the recording out to everybody then.
Yeah, and that as well. Yeah.
Absolutely.
So let's say we want to give each state a distinct color. All what you have to do is to go to your state variable and drag it and drop it on color. Now every state has distinct color. Let's say I want to show the cases in each state. Same thing, drag and drop, and you're gonna hear me say drag and drop a lot because that's what Tableau does. All what it can drag and drop. It couldn't be easier, right? So let me drag cases, drop them in color, and here you go. The darker the color, the more cases are in that state. Let me change the color to red because blue doesn't make a lot of sense. And now we have a beautiful map that shows the number of cases. When you hover over the map, it will show the number of cases. Okay, the 80 million doesn't make any sense because we didn't filter our data to the latest date. I will do that right now. Sorry, I didn't show you. So drag the date, drop it in filters, and click here and filter to the latest date. Now Montana has the cumulative number of cases in Montana is 110 cases, or 100 over 100,000 cases. So let's say we are only interested in the counties in Montana and Wyoming. How I can do that? Let me make another map really quick. So I do the same things again. States. Actually, let me go back. Now I will grab state and drop it in filters. I'm only interested in Wyoming and Montana, so I'm gonna select them here. I'm gonna filter the data to only include those two states. Okay, Minnesota. Okay, here we go, Montana. And now we double click on counties, and here we go. We highlighted Montana and Wyoming, and if we want to see the cases in those counties, we do the same thing. Drag cases and drop them in colors. Here we go. Let me change that to red or orange. Here we go. Okay, we need to filter the data to the latest date as well. I'm gonna do that. And here we go. We have now a map that shows the cases in the counties of Wyoming and Montana. What else can we do? Let's say we want to show the number of cases. Okay, before that, let's say we want to see the number of deaths as well. When we hover over these counties, we want to see the deaths. We do the same thing. Drag deaths, drop them on tooltip, and just hover over each and anyone. You will see the cases and deaths as well. And you can change how they you can change the font, the size, and anything if you want by clicking on tooltip. And let's say we want the deaths to be red and cases to be red as well. And change the size to 215, make them bold, and here we go. Now when I have to them, it looks like that. We want to see the county name on each county. It's going to be a little messy, but it's easy to do that. Just drag states and drop it on label. And I apologize. I meant to drag county and drop it on label. And here we see the county name on each county. Very simple to do. And I just want to make sure that I'm not missing anything. If you want to create parameters like the one we saw in the dashboard, like the one that's like the switch that you can switch from new to cumulative, you need a little bit experience with data analysis so you can do that, but it's not tough at all. But I just wanted to show you because maybe some of you haven't heard about Tableau before, so you want to show you that it's easy to create maps, or not just maps, any other visualization. It's easy to do that. Tableau is designed to make a dashboard. So if you're done making your visualization, you click on dashboard here and you start putting your sheets on here and you organize them the way you want. But Sandro, Yome. Okay, I think I'm done here. So if anyone has any question about Tableau, please ask me. And yeah, that's all what I wanted to share about maps in Tableau.
Oh, hey, Sam, this is Sundak, and it's really wonderful presentation. Within 10 minutes, you taught us everything else.
Yeah, I only had 10 minutes, so that's why it's,
Yeah.
I couldn't show a lot about it.
Yeah, that's okay, but I think it will be useful to you, and at least I'm interested definitely for sure to have this as a separate session too. But one question I have was, what do you think so you showed us? It's the same thing in a lot of many of the jurisdictions started using Microsoft Office 365, right? All of us have been moving towards Microsoft Office 365, and then as part of the Microsoft Office 365, you have this Power BI, right? It's Power BI. It's almost similar like what you had done. It's kind of looked like the similar features. I haven't used a lot of the Power BI. It's the same concepts, right? Whether it is use ArcGIS or use Tableau, but the concepts are the same. What you're applying the data actually, right?
Yeah, they are totally Power BI and Tableau. They are totally similar to each other. As a matter of fact, before we got Tableau, before we bought Tableau, we were hesitant between Power BI and Tableau, and we ended up with Tableau. I can't talk a lot about Power BI because I only watched some videos about it, so I don't have a lot of experience. But yeah, they are pretty similar to each other.
Yeah, the concepts are the same, right? That's the most important thing.
Yeah, yeah, they're the same.
Yeah.
Yeah, and if anyone has any questions about it, yeah, and by the way, there is a free version for Tableau you can download and practice on. It's pretty similar to the paid version. There are lots of differences between them, but probably you are not gonna even notice them. At least at first.
Yeah. I think one more comment I want to make was, I think people, most of them, they must have heard about ArcGIS, right? Because ArcGIS is what most of the states and jurisdictions and many counties are actually using it. The only advantage was they all have created already the maps, whether you can share it and you share it with public or share it with the users of them. But even if you don't use them, most of the shared maps, what they call it is you can export them as what they call as a shape files. That's the ones that you need to do. It's almost like a zip file. So you can get that shape file and you can take that one from your county or from your jurisdiction or whoever it is. You just take that shapefile and import them into most of these softwares, whether it is ArcGIS or Google Maps or Google Earth, whatever things you can import them. Of course, same thing with even Power BI and Tableau. You can import them as a boundaries, like say if you want to put the boundaries of the tribes and those sort of things. Most of the software, they do support them. I think you can use them. And ArcGIS also, it's freely available for most of the tribal communities through the Indian Affairs. Actually, if you go there, I think they give you the GIS license, so you actually can use it. And of course, some of the states also would work with you and try to work with them. And every state has a GIS resource center is there. States already shared their county boundaries, state boundaries, and whatever the common boundaries we are all working within the state. So you should be able to create them. And also many of them, they have the tribal boundaries and files already there. All you have to do is find those places in your state and work with them. And it's in public, most of them. You just import them and use it as needed. So you don't need to start from anything from scratch.
Okay. Yeah. Thank you for sharing this information. Yeah, I have just started learning how to use ArcGIS. So yeah, thank you for sharing.
And it's the same thing, what you did with the Tableau, it's the same thing, no difference at all, actually, just similar. So it's not really complicated at all. So you would be able to run through it very quickly. And then we used to provide, actually, just again, if you're all interested in doing this ArcGIS training, detailed half-a-day training is there, or one-day training. We used to have a whole set of tools that with ArcGIS, we do provide them. So one thing was the last 2.5 years, we did that one. Now we are trying to move towards keeping it more open source in the sense, keep it simpler
tools, right? Like things like Google Maps or things what they already have, whether it is a Tableau or Power BI, whatever the things like have. So that's sort of a more of an open concepts, free tools. So you don't need to necessarily always worry about the licensing issues.
Oh, okay. That's nice to know. Yeah, thank you.
Sundak, well, everyone, this is Erin. I have reached out to Esri, they're the makers of ArcGIS, and they have a team that is ready to help tribes, and I can connect you with them at any time.
Yeah, that's a good point, because every state has a point of contact as their representatives are there. And also for, we've been working with the response for the COVID response, they're actually even providing a free license, free support too. So they could actually, if you don't have a website or don't have a ArcGIS maps, they can actually set up this, most of the states have these dashboards, right? They have some sort of a templates are there. So they can work with you within a day or two. They can put up the dashboard for you all in the site setup. It's a more of a template based approach. So they could work with you and then provide the support, not just to giving a license. You use those templates to work around. So I think maybe also one of the things in the evaluations we were really looking for was maybe create this in the CDC train courses. So like the way we did only 45 minutes of using common tools, right? We want to start with the Google, because that's something that everybody knows it don't need license. Everybody's already using it. So implementation would be a lot easier. And of course, people can share their maps based on what the sensitivity of the data, whether they want to make it public or restricted access, just like any other Google documents, right? Or you want to keep them only in the desktop. So, and also people have misconception Google means everything has to be online. No, it can be kept offline. It can be available as offline too, whether it is maps or documents. And also Google Earth, the desktop version is also something that you can pretty much do most of these things that you have. I think there's one of the tribal epidemiology centers, they created nice YouTube clips for the whole Google Earth, how you can actually use it. Maybe something we will include them as a resource. So I think it's like a 3 or 4 part video series. So you can easily do, and Google itself has created all these nice documentations. It's just a matter of putting all of them together with a hands-on activity would be useful. Maybe we can think about it, Erin and Jennifer, just see if you can put some course together and put them in the train actually, so that everybody can actually use it. It's just a self-learning things that they can actually use it. Start with that, and then after that, gradually we can expand to other tools.
Absolutely, that's a great idea.
Yeah, we got requests from a lot of them to do these sort of things, put them in the train. And I said, I know you're already trying to put a lot of your courses on that CDC train. So this will be a good thing for all the not only tribal communities, but just everybody else too, right? It's more of an emergency preparedness and response, that kind of a context, right?
Absolutely, yep.
Yeah, we have to check with our IT to make sure that Google is okay and work with them. Yeah.
That's important too. I mean, it's a data. There are tools out there. Every tools are there. Whether it is you go with ArcGIS or Power BI or any of these things, you still have to work with the data sensitivity or what sort of sharing you can do, whether it's outside, inside, that sort of things. Like that was giving example. Fort Hall, really, they didn't want to put certain things outside, so they want to keep it there. But in some communities, they were giving it for the people who are working there. So it's all, and it's also the type of data, right? You can anonymize, but at the same time, you just want to still be careful, actually, right? What sort of things you're putting them in there. And some of the, not only public health, so the transportation departments, they have put all of these maps too, using Google Maps. So Jennifer, I know we are ending the series. Definitely, we are not going away anywhere. So anytime, I know you're all they're all in good hands with you all. If you all need any support, so just how to reach out to us, and we'll be glad to help you in any way we can.
We sure do. I have your email on speed dial, basically. How about any other questions, comments, suggestions from the group? Okay.
Jennifer, do we have a plan for what's next? What do we want to cover next?
I believe that the next thing that we're going to look in are Excel 101 and maybe more advanced Excel classes for both like not only data management, but also for things like contact databases or just the cool things that you can do with Excel, Smart Sheets, the different versions out there, Gantt charts, React charts to help keep track of projects and lists. And so there's all kinds of things that we can do with Excel. And I think that's going to be the next series, but it's going to take us a little bit to put it all together. So. And then there's some more things coming out, like I know that each tribe oftentimes will have specific needs. And so we are starting to look into all the different free training that is available within the train.org website or learning management system. And so like if you have any specific needs just for your group, please reach out to me and we can get you hooked up with whatever you're looking at. So some examples that that people have already requested are things like team building. So team building workshops or communication skills. Let me think. What is public health and epidemiology 101? Motivational interviewing. What is population health, etc. So if there's anything that you're looking for specifically, we will be able to perhaps get you started on train.org to see if that meets your needs. And then if we need to expand on that, we can.
And thanks, Jennifer and Erin and others, actually, for the last few weeks. You all laid out a nice foundation for us. You brainstormed with us, actually. Oh, this is what the tribes, the staff that we are working with maybe benefit. I mean, you gave us all the things and helped us actually too. So let us know anything we can be of help. Not just, it's not an end. So we're definitely here to support. And also, if you have any courses, please do let us know. We want to join too and learn from you all too. So just please.
Sounds wonderful. It has been an absolute pleasure to have you, Sundak, and the team from CDC. You guys have been amazing to work with. It's so much fun, and I really appreciate when you put yourselves on camera so we can all see you. And you don't have to if you don't want to. Any other comments, questions, things before we wrap up for the day? Well, seeing none, nothing in chat, no raised hands.
Yeah, thank you for sharing the videos. I mean, so we can put the names of the persons to the video, actually. That's really nice.
Absolutely. Thank you everybody for joining us. Thank you to our honored guests from all of our tribal departments, and thank you for anybody who forwarded our series to other people so they get to see what we're doing. Thank you to the CDC for every bit of the training. It's been so wonderful. Thank you to my RMTLC staff for joining us and support and ideas and everything that you've brought to our table as well. Thank you. I feel very blessed to know all of you.
Thank you. Thanks for giving us an opportunity to work with you, and we're planning to continue support, and we're going to learn from you too.
Fantastic. Thank you. And for everybody, I hope that you have a very wonderful day, regardless if it's sun or snow.
Okay, thank you. Bye-bye.
Bye-bye.
Bye. Thank you so much.
Thank you all.